are negative. A lot of patients have gotten tests that they're told are abnormal and are the reason for the symptoms. And it's really important to understand those tests. So they can be things like what Maria talked about, the Epstein-Barr virus, or chronic Lyme, or mold, or heavy metal toxins, or, there's lots and lots of different tests like this that are generally not the mainstream medical tests. And the reason why is because generally, well, a couple of things. A lot of them have not been scientifically validated, despite actually having tests and studies done on them. It's not that the tests and studies haven't been done, but they haven't been shown to be the reason for the symptoms. So, for instance, with Epstein-Barr virus, what we're testing is an antibody, which means that it's the body's own normal, healthy response to the virus. It's not the virus itself. And as Maria was saying, 95% of the world's population has a positive Epstein-Barr virus test because it's just a normal antibody. We've been exposed to it throughout our life. And the same thing with things like mold or chronic Lyme is that those abnormal tests have not been scientifically shown to be the reason for the symptoms. So if we look back at, well, why did someone get sick? There are these risk factors, or the hypervigilance in someone's brain, or what their brain and their nervous system is in place, and then they get sick with a virus, an Epstein-Barr virus or COVID, or lots of different viruses, and that can be the thing that tips people over the edge. The virus goes away, like our body fights the virus, like with Claire's son. But then the brain's protective signals is what is persisting. And in that part, that's the counterintuitive part where we need to move instead of rest. I mean, when we have an acute illness and we're very, very, very sick with the acute illness, resting does make sense so that our body can fight the illness. But once that signal gets stuck in place, then it's leaning into it and showing the brain that we actually don't need those signals anymore. And that's not easy, and it's counterintuitive, but really understanding all those pieces. But it's not about an ongoing infection.